President-elect Joe Biden is unveiling his plan today for how he will administer COVID-19 vaccines. Last night, Mr. Biden outlined his $1.9 trillion economic relief package. He says it will help fund vaccinations as well as provide immediate relief to families and communities. This comes as the president-elect announces Dr. David Kessler will help lead Operation Warp Speed. Dr. Kessler previously worked as FDA commissioner under Presidents George H.W. Bush and Bill Clinton. For more on this, I want to bring in Norman Baylor. He is the president and CEO of Biologics Consulting and the former director of the Office of Vaccines Research and Review at the FDA. Norman, welcome. Great to have you with us. So the president-elect has repeatedly said he wants to administer 100 million doses of the vaccine in his first 100 days in office. Does that appear to be a realistic goal?
It's an aggressive goal, but it's something we need. We really, given the fact that we have over 390,000 deaths, over 23 million cases of COVID-19, it is definitely something that we have to have. We have to move forward in that direction.
Now, the Trump administration had pledged to vaccinate 20 million Americans by the end of 2020, but we know that didn't happen. According to the CDC, as of today, only 11 million doses have been administered so far. Where was the weak link in this distribution chain? Why has it been going so much more slowly than lawmakers had hoped?
You have to have a plan to do a mass immunization program. And you have to, the current administration, the focus, rightfully so, was on the research and development, getting a vaccine made and authorized by the FDA. And that part has happened. But also in that plan, you need to create a pathway, if you will, for distributing and administering the vaccine. And that's where the current administration really failed, because there was really no coordination with the states, with the localities, with the communities. We've never done a massive mass immunization program in the United States in current history. So we really needed a plan. And with the plan, and it sounds like the incoming administration is developing a plan. The key to that plan will be administering doses. Now, you mentioned that there's approximately a little over 11 million doses that have been administered. There's approximately 32 million doses have been distributed. Where are those doses? Mm-hmm. We need to make sure that those doses get into arms as soon as possible.
Good point. Good point. Where are those doses? So that kind of leads me to my next question, which is about President-elect Biden's plan to release all available vaccine doses instead of waiting to be sure a second dose is available, which may be what's happening there with this delay between what's being distributed and what's actually been administered. But you also think that there is a risk to this. You've mentioned that before. Can you explain the risk and what needs to be done to mitigate that?
Yes. There is a risk, because anytime you deploy or administer a vaccine off-label, I'm going to use that term, and that's away from the instructions or data that were generated for authorizing this vaccine. This vaccine was authorized under emergency use as a 2-dose schedule. The efficacy data was determined by 2 doses, not 1 dose. So although the plan to distribute all the vaccine, getting the first dose out, it has some risk to it, you can mitigate that risk by making sure, do you have the second dose that will come on time? Pfizer's vaccine, 3 weeks after the first dose. Moderna's vaccine, 4 weeks after the first dose. So that's the type of data you need in order to make this move to administer all of the vaccine. You need to know in the pipeline that you have that second dose that will be delivered on time or close to on time. It doesn't have to be on the exact date, but close to on time, to make sure that those individuals who receive the first dose, who are due the second dose, are not in a vulnerable state. And let me just explain a little of the data to you. As I indicated before, the efficacy was determined after the second dose. So you do see efficacy after the first dose. But what you also see is a modest amount of neutralizing antibodies, and that's part of what protects you from this virus. And so you need that second dose in order to get a robust response that will hopefully last and have a good duration to protect you. We don't know the duration of protection after the first, and data are still being collected on duration of protection after the second dose. And in fact, those individuals, participants in the clinical trials, will be followed up to 2 years so we can determine what that duration of protection is.
And really quickly, Norman, before I let you go, do we know how quickly after that second dose the patient has received, sort of full protection? Is it a few weeks after? Is it immediately after? When can they assume that they've reached the full protection of the double dose vaccines?
Well, let's just make sure that the full protection, it's adequate protection, and that's in weeks. So you see a boost after that second dose, but again, we don't know the duration of protection. We're still collecting that data, but we know that the response after that second dose is very robust and protects you longer than that first dose.
Right. And of course, I just want to clarify, we know that 5% of the population in these tests did not receive the protection. So there is no vaccine that offers full protection, but a 95% efficacy rate is quite impressive. All right. Well, Norman Baylor, thank you so much for joining us.
Sure. Thank you.